Good morning, everyone. On behalf of NASH 24 by 7, I welcome you to our public awareness program on NASH Knockout Tips for a Healthy Liver. NASH 24 by 7 aspires to bring best in class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, we have a renowned gastroenterologist from Mumbai, Dr. Priyesh Patel, sir. He needs no introduction. However, I would fail my duty if I don't mention that Dr. Priyesh Patel is a leading gastro in Mumbai, providing the comprehensive care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with Gastro Health Clinic Mumbai as senior consultant gastroenterologist. Sir, we salute your dedication to spreading awareness related to liver health. So now I invite Dr. Priyesh Patel, sir, to enlighten us on the topic. Over to you, sir.
Thank you for a very kind introduction. Without much ado, let's go ahead with the program for today. What is basically a fatty liver or a non-alcoholic fatty liver disease? We will be coming to the basics of the liver, the fatty liver, and the tips for prevention of the same. So, liver, as we all know, is the second largest organ of the human body, and it is located in the upper right portion of the abdomen. The liver has so many functions. Everybody feels that only digestion is one of the functions of the liver. No, liver has so many functions like processing of the nutrients, destroying of the old RBCs, regulation of the blood composition. The main function is production of the bile. This bile is important for digestion of the fat-soluble vitamins and the fats. Then detoxifying the blood, breaking down of alcohol and other medications, controls of other metabolic processes, and protein and cholesterol synthesis. So, non-alcoholic fatty liver disease is a condition which makes about more than 5% of the weight of the liver, not caused by the alcohol. So, usually up till less than 5% of the if the liver is of fat, then we do not label it as fatty liver. But anybody who is having more than 5% fat composition of the liver, then the person is labeled as a non-alcoholic fatty liver disease. If it is left untreated, it can progress to a severe stage called as non-alcoholic steatohepatitis. I will be coming to the both the differentiations in a few slides. Being overweight or obese, having type 2 diabetes and high cholesterol are associated with increased risk of NAFLD. What is the prevalence of NAFLD? So 1 in 4 of people will have NAFLD, will have regardless of weight. So usually it is very well associated with somebody who is overweight and having diabetes and cholesterol. But irrespective of the weight, 1 in 4 will have some sort of a fat accumulation of the liver. So it is very common. And out of that, more than 6 diabetics and 9 with severe obesity will have of 10 will have non-alcoholic fatty liver disease. So if you are having diabetes, if you are having overweight, then the chance of having non-alcoholic fatty liver disease is very high. Male gender has a higher risk of progression to non-alcoholic steatohepatitis. There is a spectrum of a disease. Non-alcoholic fatty liver disease starts from basic fatty liver, which is just a fat accumulation to the liver. But if it continues, it may progress to fibrosis, it may progress to steatosis and non-alcoholic steatohepatitis, and finally to cirrhosis of liver and even liver tumors. Not everybody who will have fatty liver will progress to all the stages. But if you see the prevalence of the NFL, if it is so common, then even if a few people out of that particular portion will progress to a severe disease, then we'll have a very high percentage of people who are having a non-alcoholic steatohepatitis or NASH as a disease per se. This is a very good diagram. Progression of non-alcoholic fatty liver disease. See the healthy liver, the color and the contour. When there is fat accumulation in the liver becomes more smooth and it is glistening yellow. After that, if the fat keeps on depositing again and again, the liver becomes fibrotic. That is, there are some sorts of areas of stiffness coming into the liver. And if this persists, then there will be something called as cirrhosis. Will be complete liver will be reversed with a scar tissue. The good thing is that even if you are at a fatty liver, there is always a chance of reversal. And even if you are at a mild fibrosis stage, there is always a chance of reversal to fatty and then to normal liver. But if you find out the person in question at a cirrhosis stage, then it is not possible to go back so easily. And that is why the whole idea of the public awareness or the whole idea of everything here is that we should catch hold of the individual as early as possible so that we look at chances of reversal rather than treating a disease life. What is the difference between NAFL and NASH? As I mentioned, NAFL is non-alcoholic fatty liver is only the fat accumulation into the liver. As if you go to the previous diagram, this is the NAFL. This is the fat diagram. So right now, this is not harming the liver. We are having no symptoms. This is still okay to have it, but obviously we will want it to get reversed into a normal liver. And as compared to non-alcoholic steatohepatitis, the scarring has started taking place. And once the scarring has started taking place, then that is the area of concern because if it keeps on progressing, the next stage would be cirrhosis of liver. What are the other causes of non-alcoholic fatty liver disease? Obesity, we have already mentioned. Some people it is genetic, it runs in the families. Heavy calorie intake and lack of exercise, physical inactivity, being exposed to certain medications, and metabolic syndrome, out of which obesity and fatty liver disease are the most common cause. Unfortunately, in the current arena, where things are very easy over the net of getting food from the net or working from home, the level of exercise has gone down. And with that, being overweight or obese is becoming more and more increasingly common in the current population. And obesity increases the fat amount to about 5 to 10%, and this leads to NASH or non-alcoholic steatohepatitis. There is a threefold increase of death due to cirrhosis because of NASH, and because of diabetes, there will be two to fourfold increase of developing diabetes in NASH. What are the symptoms of NASH? Usually, a non-alcoholic fatty liver disease, many people will have no symptoms at all. Some people may have mild fatigue, discomfort, or pain in the upper right column. If there is a severe progression of NASH symptoms, if the liver has become stiff, then the symptoms come very late, and in that symptoms will have increased fatigue, build-up of fluid into the abdomen, which is called as ascites, confusion, that is encephalopathy, a decrease of appetite, bleeding easily, unexplained weight loss, swelling over the feet, yellowish discoloration of the eyes and of the hands, and some people will even have go into progressive into vomiting with blood or dark colored stools. So diagnosis is very important, and diagnosis is by a variety of tests. No single test is right now available to diagnose formation of NAFLD very easily, but there is a combination of a blood test, a simple ultrasound, or a fibroscan. Very rarely we do biopsy, and sometimes we do a CT or an MRI also. So most commonly to find out the blood test SGOT and SGPT levels, persistently elevated ALT can be associated with disease progression, and the ALT level can also develop progressive disease. Up to 80% of NAFL patients can have still have normal ALT. So it depends on what time you do the test. But then ALT is still the single most marker. Where if you have a persistently elevated ALT, we have to think in terms of working up for non-alcoholic fatty liver disease. Similarly, there are other scoring methods like the FIB4, which includes the age, the AST, ALT, and the platelet count ratio. And there is a certain NAFLD fibrosis score, which are organ tools for finding out whether the patient has NASH or no. The most common method is the ultrasound. Ultrasound, if you see the images here, this is the normal liver. The moment it becomes fatty, the liver, which you can see the normal waves, the wavy pattern, and the granular pattern here, it is all taken up by the fat. It becomes more blurred. And finally, if it is cirrhotic, the liver is shrunken in size. There is some fluid beyond the liver also, and that is the issue. So, use of ultrasound, that it is very easily available. Almost now, all the centers have ultrasound, very reasonably cheap also, and reason for accidental diagnosis of most patients. So, somebody has abdominal pain, somebody has gone for renal stones, somebody has gone for just a routine checkup, and at that time when they do ultrasound, that is a very common finding to have a fatty liver as a diagnosis. So not everybody needs to worry, but obviously if you have fatty liver into diagnosis, we have to make sure that we are into that stage again. It is a reversal stage and it will not progress and go into cirrhosis. The problem with ultrasound that it only detects about 25% of fat in NAFLD, and it cannot differentiate between fat and fibrosis. So ultrasound, whether it will tell you normal and it will tell you fatty, and it will directly tell you cirrhotic. So in between the stages, whatever the stages of steatosis or fibrosis, where there is still a chance of reversal, ultrasound will still label it as fatty. So we will not know whether we are having a progression of disease or we are having a normal liver. So there are certain fallacies of ultrasound also. So in that context, in that fallacy, what we do is what's called as a elastography. or a fibroscan. So elastography gives us a more accurate evaluation of the fat percentage of the liver and whether the liver is fatty or not, and whether the liver is fibrotic or not. This also is very easily visible. It is a non-invasive test, no radiation, safe in pregnancy also. The problem here is if the individual is very obese, then there will be some sort of a misinterpretation of the reports in this context. Non-invasive diagnosis, MRI is the gold standard. This is available in only centers in the higher centers in first tier cities, not available in very smaller centers. But it is basically a gold standard for fat detection, and it can measure up to fat content for greater than 1% also. It is not widely available and is slightly costly. Liver biopsy, as I mentioned, only in few percent. Now, almost in 1% of patients only we do liver biopsy. Otherwise, with the combination of blood test, ultrasound, and fibroscan, and if possible, an MRI also, we are more than happy not to do any invasive procedure like a liver biopsy. Only a liver biopsy is done if there is a alternative diagnosis also which is at hand, and one liver biopsy can differentiate between both the diagnoses. So what is the progression which takes in years for the intervention will be beneficial? So if it is only isolated fatty liver, then none to very minimal progression to fibrosis, and there is no increased risk of death compared with the general population. So if it is only mild fatty liver, fibrosis is okay, LFT is okay, weight is okay, no diabetes, no cholesterol, then the chance of progression to fibrosis is almost zero. Now, with it goes with the fat keeps on accumulating with fatty liver with mild inflammation. That is, the fibrosis is showing some sort of inflammation, AST/ALT is elevated. Then there is a chance of progression to NAFLD, and NAFLD from that 20 to 25% of all patients with non-alcoholic fatty liver disease will go into non-alcoholic steatohepatitis. Out of this non-alcoholic steatohepatitis, 11% over 15 years with significant variability will go into cirrhosis of liver. And out of the cirrhosis, almost 45% patients over the next 10 years will go for decompensation and which will require liver transplantation. And about 7.2% over the next 6.5 years will go for liver cancer. Apart from that, there is always a very increased risk. Even if there is a no increased risk of cirrhosis or decompensation or cancer, there is always a very increased risk of death compared to general population with any cardiac mobility, with any malignancy, and with any liver-related malignancy. And along with that, therefore, that is very important that if it is fatty liver or mild fibrosis, the first thing is to act it before it is too late, because after a certain time, cirrhosis will not be reversible. What is the treatment? Simplest of the things. Most commonly, it is diet and exercise and lifestyle modifications. Some medications will be required. So, what do we mean by weight control your weight gain? A combination of a low calorie diet and moderate intensity exercise provides the best likelihood to sustain weight loss. If you achieve a weight loss about 3 to 5% of body weight, then there is a reversal chances start happening. And if you achieve a weight loss about 7 to 10%, then the majority of histopathological features of NASH will be reversed. So how much is the weight loss affecting? This is a very good chart. If the weight loss is about greater than equal to 3%, then the steatosis, the amount of fat into the liver will be reduced by almost 35 to 100%. When you reduce the weight from 3 to 5%, the histological changes, cellular level ka changes, microscopic changes will start taking place. When the weight loss will be about 7%, sustained weight loss, then they will be starting resolution of the NASH, and the person will come back to a fatty liver or almost a normal liver. And secondly, if you can achieve a weight loss, a sustained weight loss of about 10%, then there will be very important. Then the fibrosis also, the whatever the stiffness part will also be reversed in almost 50% or 45% of patients. So most important treatment is to have a reduction in the weight loss. Diet for a healthy liver, usually we prefer a Mediterranean diet, which includes everything, but in proportion. So most of the times, so every day we should have a diet which is rich in a lot of colored fruits and vegetables, whole wheat and grains, beans and legumes and spices. Then weekly we have some moderate portion of eggs, poultry, cheese and yogurt. Very less we have red meat and sweets, and very commonly we can have twice a week can have fish and seafood because it is good in omega-3 fatty acids. Along with that, physically staying physically active and having 7 to 8 glasses of water, it should be the recommendation. And the type of exercises, as I mentioned, with the exercise, the fat liver will get improved to a normal liver. It includes a combination of both aerobic and resistant exercises. Aerobic exercises include your cardio, walking, jogging, cycling, skipping, basically improves the cardiovascular conditioning, and also resistance training or strength training. So simple weight lifting, which will help you in reducing the liver inflammation, improves the glucose absorption, and improves the metabolic parameters with less consumption. So combination of these two is the ideal solution where exercise will help you in reducing the weight and eventually help you in reducing the non-alcoholic steatohepatitis. And most importantly, so everybody knows this, but then finally it is very difficult to in the current scenario it is difficult to accept all this. But most commonly develop an exercise routine, get enough sleep, vitamins and minerals, regular annual checkups, small frequent meals, and low intake of sugar and carbohydrates. What does the Indian National Association of Study in Liver Disease recommend for pharmacological treatment? So there are three medications with the INSL recommends. One is vitamin E, which can be given safely for 2 years. One is pioglitazone, which can be given for 2 years. And the most common medicine which is prescribed now, which can be given both for diabetic and non-diabetic patients, which is saroglitazole. This is an old recommendation. It is for 1 year, but now we know that saroglitazole can be given for more than 1 year also in patients for fatty liver and significant amount of NASH. Tips to prevent the fatty liver disease, again the same. Eat a balanced diet, low consumption of refined carbohydrates, maintain regular weight, limit avoid alcohol, exercise regularly, and quit smoking. And most importantly, the liver is the only organ which has a chance of regenerating, and it can go back to its normal shape. But we have to provide an environment so that it goes back to its normal shape. But once it has progressed to a certain stage, that it will never go back to its normal shape. The idea is to catch hold of any disease or disease outcomes very early and then treat it likewise so that we will not be having any disease and we'll be having a healthy life. Thank you.
Thank you, sir, for this wonderful talk. This has really
Thank you.
enlightened us. Now we will take questions from our audience with your permission.
Sure. Thank you.
So, sir, few questions are there in the chat box. Uh, the first question is there: can we get NASH without the consuming alcohol?
Yes, so the definition of NASH is non-alcoholic steatohepatitis. So even if you have never heard of alcohol, even if you have never thought of alcohol, but if you are genetically predisposed, or you are having obesity, or if you are having a family history of diabetes, or you are having cholesterol, and there is an inactive physical activity, then they can get NASH even without even thinking about alcohol. Forget about drinking about alcohol.
Okay. Sir, next question is which type of food to avoid in NASH?
So most commonly, as we saw in the previous slide, that having a good Mediterranean diet is a balanced diet is the key for taking. So avoiding food which is high in unsaturated fats, avoiding food which is over the counter. What I usually tell my patients or the or people who ask me this question, that avoiding anything which is processed, which is easily available. You can open a packet, cook it, and then eat it, or maybe open a packet and consume it directly. You should avoid that kind of food because usually these are processed food and having a lot of preservatives and saturated fat to preserve it, and that is why they cause more issues. And basically, the idea is that whatever you consume, if you are spending more calories than whatever you have consumed, then you can jolly well eat everything under the sun. But it is not possible. Let us assume that you have a good sweet and stuff. The calorie intake becomes very high. To expedite that kind of a calorie, you need to be into the gym for almost more than 3 hours, which is impractical because you have to earn a living, you have to take care of the family. So moderation is the key. But basically, whatever you eat, you have to start exercising, and that is the only treatment from here.
Thank you so much, sir, for your valuable feedback. Next question is NASH age specific?
Yes, not really. Matlab, yes, we do definitely find NASH common in the third and fourth decades now because it is usually a accumulation of fat into the liver over a period of number of years. So even if you have a teenage obesity and stuff, but you still keep on having that, then we usually find it very commonly in somebody after the fourth decade. But in the current scenario, we do see NASH even commonly in children. Unfortunately, we see it in children. This is also because of the inactive physical activity and because of the lifestyle. Because children, we are also seeing a growth in the obesity and the fat levels into the children. The child may be young, say 5 year, 10 year, 12 year old, but they look so huge and so bulky. Mentally, they are still children, but then physically they are growing beyond their age. And with that, the activity level keeps on coming down, and they are focusing more on diet, which is not healthy. And we see it in children also. So earlier we had a state pattern where NASH was seen more commonly after a certain decades, but now we see a combination of both, and unfortunately, the rise in children is increasing.
Okay, sir. Sir, next question is how much alcohol is permissible in NASH patients?
The answer that any doctor will tell you, the answer is no alcohol is permissible in NASH patients, and there is no limit of alcohol. So there are so many studies in India. We have no study that how much alcohol is a. There are certain studies in the Western literature, but then we do not replicate it. As a doctor, I would recommend no alcohol. Alcohol you have to stop completely. There is no point in taking alcohol and then thinking that your NASH is getting reversed. No, you cannot have alcohol.
Okay, sir. Sir, one more question is there in chat box. Does abnormal liver enzyme always mean it is NASH?
No, no. Abnormal liver enzyme because maybe because of many things. So, right, the simplest common causes are most common. Let us assume that somebody has any infection, any fever, any viral infection, malaria, dengue, typhoid. Then also there will be some sort of a abnormal liver function test. So, how do you interpret the liver function test is important in that context. So, if you are having a persistently elevated liver function test in the absence of any other disease, then we think in terms of NASH. Otherwise, if I've got somebody who is taking certain medications for tuberculosis or epilepsy, some homeopathy, Ayurveda, and there is a liver function test which is deranged, I will still have a thinking that maybe it is because of drug induced, or somebody is having malaria and dengue, and then I am getting a liver function test deranged, then I will not think of NASH at that point of time. I will still think of it as a more of an infection related. Once the infection resolves, we'll repeat a LFT and see. If the LFT is normal at that time, then we need not worry about it.
Sir, next question is there. Is fatty liver reversible?
Completely reversible, 100% reversible. There are three main treatments for fatty liver to get reversed: diet and exercise, diet and exercise, and diet and exercise.
Okay. Sir, now questions are over.
Thank you so much.
So, on behalf of 20 NEST 24 by 7, I thank Dr. Nikhil Patil, sir, for this lively and informative talk. As you have been emphasizing the awareness for the liver health and disease, it is equally important for the people affected by fatty liver to regularly visit doctors and continue medications with careful observations and precautions. It is possible to obtain the control of the disease. I would also like to thank our audience for their active participation and patience in making this event successful. Stay connected with NEST 24 by 7 on Facebook and take care of yourself and your family members. Thank you. Once again, thank you, Dr. Priyesh Patel, sir, for connecting
Thank,
us on NEST 24 by 7.
thank you